Scenario 5, Jason. Jason felt like he had been hit with a Mack truck. He was having a hard time walking. He asked his brother to take him to the local hospital emergency room. He was there for about 8 hours. His knees were x-rayed. Then he was sent home with a prescription for painkillers and to see his doctor. He made an appointment with his doctor, a doctor from, you fill in the blanks, America. Jason was so frustrated. He got nowhere with this doctor. He left out of the appointment so frustrated that he filed a complaint. When he left the clinic, he wasn't feeling well, so he called a taxi. He asked the driver to drop him off at the store near his apartment. After he left the store, he was walking really slowly. He stopped to rest a bit. Oh, he went. Then his right leg twisted and buckled right from underneath him. He went down. He took out his cell phone and called the paramedics. Back to the hospital he went. He had cracked a fibula. Upon being released, he was told to go to his doctor ASAP to get a referral for the orthopedic doctor. Well, we know the story of his doctor. By the way, when he registered the complaint, he was assigned another doctor and scheduled an appointment for the month of December. So the next day, Jason, his sister, and Mom went to the county hospital. First he went to registration, wrong. Then to urgent care, wrong. Then to emergency, ding dong, right. He registered, got his vitals taken, then it was hurry up and wait. His sister and Mom went home. He was then called to be seen. He was told that if he had made an appointment for the following day, that he would be seen quicker. Otherwise, it would be 14 to 24-hour wait. He opted for the next day appointment. The appointment was for 1:30 p.m. The next day, he was back at the hospital at 1:30. Turns out the 1:30 appointment was just to check in. 4 hours later, he was seen, x-rays and all. The resident looked at his x-rays and asked him what was going on. He started to tell her the 411. She cut him off and said that she needed to know what was going on with the here and now, that she had other patients to see. In other words, cut to the chase, I have other patients to see. Jason wanted to say, well, I have been waiting to see you all morning and afternoon. I think it is important for you to know what led up to the fall, in addition to some other history. But he didn't. He didn't even ask any of the questions. He was told that he was going to get a shoe cast because he had a fractured fibula. So on went the cast. To make a long story short, he asked for a walker. The social service department closes at 5 p.m. It was a little after 6 p.m. So on he went with his makeshift walker and all. He thought thanks to the internet, he could do some research and find out about fractured fibulas and anything else he needed to know. He was told to come back in 2 weeks and go right in to see the doctor. He went to ortho 2 weeks later. Shaka-roo-roo-roo, a room filled with people in wheelchairs and all sorts of casts. He still had hope. He went to the window and said he had an appointment at 1:30. The lady said, put your appointment slip and card in the basket. What was he kidding? Again, hurry up and wait. 2 hours later, he was called in and cast was taken off and his leg x-rayed again. Turns out he still needed the cast, but he found out that he had sprained his ankle when he had fallen. The resident from the first visit never told him that. He had told the doctor when he was walking on his foot that he had felt pain in the heel. So another cast was put on by another cast person. His technique was totally different from the first person. After he was done, the cast seemed to be too short and too tight. Anyway, he got up and he had the hardest time walking to the door. He was advised not to use crutches, so anyway he leaves to go get another appointment. He had to wait another hour for that. He was finally called and given an appointment for 2 weeks later. Also given paperwork for a walker. That paperwork had to be taken to social services. He wouldn't get a walker then, it would be delivered to his home. What time frame? Who knows? Again, it was 5:30, so social services was closed, so home he goes. He was quite frustrated. Jason feels that this whole fall could have been prevented if his regular doctor would have listened to him and examined him. Food for thought. It just dawned on Jason. Jason had time to kill while waiting for his appointment. He sat and waited for his appointment near one of the security entrances of the hospital. He said he's going to have to go through that metal detector. He sat and he watched women put their purses and belongings on the tray and go through the metal detector. He watched the men empty out their pockets and put their belongings in the tray and also go through the metal detector. Sometimes the buzzards would go off, and he watched the guards use a wand detector and scan the person's body and ask them to lift their pants legs up. Jason knew it was going to be his turn soon. Intellectually, he knew it had to be done. You hurry up and you wait here. Tempers flare sometimes. But he didn't like this feeling like a criminal. Just like our airports, he welcomes the long waits and the security. Now, he asks this question. If this can be done at the county hospitals, to beef up the security at our airports, why can't we beef up the security and close our borders?